I won't take much time, maybe another 12-13 minutes. But I thought I'll just introduce you this topic which is going to come up in a big way. Not in the next couple of years, but at least in the next 5 to 10 years, you will have to come across this. Whether we want or we don't want, it will be there. Somewhere people will be talking or somewhere people will be practicing. So basically, AI it's like an automated system to perform tasks that needs human intelligence. So the machine is learned to kind of act like a human intelligence. So it mimics the cognitive functions that humans associate with the human mind, such as learning and problem solving, like how we learn certain things, like how we have a differential diagnosis and a plan. The machine is learned with a lot of data to do this and to solve certain problems. So whenever I used to see this image before, I used to think one day it's going to happen. So that is where now we are going. There is an Intel inside and so many of us outside.
Yeah, it's hard to get noticed when you're new, but that's okay. I'm not looking for attention. I'm happy just helping people out, making their work lives work better. I take care of the routine stuff so others don't have to. I guess you could say I'm wired that way. I happen to do things a little differently, so work gets done faster. I've gotten so good at it, it almost takes care of itself. I usually solve problems before they come up. I'm a good listener. I pay attention to the details, look for patterns. What can I say? I love data. Intelligence doesn't come easy. I'm learning new stuff all the time. So I can make suggestions and help out more. I don't expect any fanfare, a pat on the back, or even a thank you. The way I figure it, if I'm doing my job right, people won't really know I'm there. You know what's funny? Even though they don't seem to notice, I see the difference I make. And at the end of the day, that's enough for me. Why do I do it? I don't know. It's just how I'm made.
So I like this video because it covers most of what we are looking at AI for. It kind of, with big data, you feed a big data. It's like training a dog. And then the dog can find out where you hide your watch or things like that. So there's so much of data which is fed, and then it can start recognizing the patterns. So once it starts recognizing the patterns, then it can start recognizing conditions, like how human brain works. There is a neural network which works, and when they are able to identify. So these are some of the terms which you will be hearing soon. Now more and more people will be talking, but basically these three terms are kind of overlapping terms. So artificial intelligence are programmed with an ability to learn and reason like humans. But for this, the basic inner concept would be machine learning, where you develop algorithms with the ability to learn without being explicitly programmed. But if you can explicitly program it, then it becomes deep learning, a subset of machine learning in which artificial neural networks adapt and learn from a lot of data which you feed in. Like you can feed in thousands and tons of diabetic retinopathy for it to start diagnosing exactly to say, is it a mild, moderate, severe, is there a cystoid macular edema, whatever Dr. Manavi was discussing, the system would start predicting. So that is how you make it learn deep. So these are terms which are very important when you talk about artificial intelligence. So this image I came across, it looked interesting. So when people talked about statistics, there is nobody to take a look at them. And then they started framing a statistics. Then they said we are doing machine learning, nobody bothered. Then somebody said I am doing artificial intelligence. There is a lot of crowd to see. That's what is really happening. Even some of these models were there before, but not in a big way. But now with the supercomputers, more and more data and more information available, now we are able to do a lot of this deep learning. So this is again something which you have to keep in mind. There is something called supervised learning and an unsupervised learning. Supervised is like if diabetic retinopathy images are again kind of fed and then analyzed and also supervised by an ophthalmologist. Okay, so Manavi says this is NPDR, this is mild, this is moderate, and makes the computer learn that. No, you do an exact classification and you make the computer to learn, then it is supervised. Unsupervised, you keep seeing day in and day out. Okay, you search Bangkok, the very next minute in your Facebook, it will say this hotel is so cheap in Bangkok. You can try this massage in Bangkok. So they'll start pushing in ads and advertisements. You don't know where they got the information, but you would have done something. No, even now people are talking about, they were questioning Mark Zuckerberg, is the microphone listening to what you are talking when the Facebook is on? Is the camera picking up? Because you are talking about somebody and immediately that friend request is there. No, உங்களுக்கு கூட friend ஆகிக்கிறீங்களா? நான் தேடவே இல்லை இவரை, பட் அவரை பற்றி பேசியிருப்பீங்க, அவரை பற்றி ஏதோ ஒரு கான்டெக்ஸ்டில் பேசியிருப்பீங்க, சம்பந்தமே இல்லாத ஆளுக்கு அங்கே ரிக்வெஸ்ட் கேட்கும் ஃபேஸ்புக்கில். ஸோ that is kind of unsupervised. No, there are tricky things which are happening, which we all have to keep in mind. No, they don't know how it really works, but there are a lot of unsupervised learning. So this is another image which I saw some time back on what will happen if there is an unsupervised learning. I ordered a stool and Amazon said, customers who bought this item also bought this. Okay, so this is unsupervised learning. When people ஒரு 4-5 பேர் இதை மாதிரி வாங்க ஆரம்பிச்சாங்கன்னா போதும், நீங்கள் நம்ம அந்த சாணி தட்டுற அந்த இது கூட விற்கிறாங்களாம் இப்போ அமேசானில். அது வாங்கும்போது இதையும் சேர்த்து வாங்கினாங்க, அது வாங்கும்போது கேஸும் சேர்த்து வாங்கினாங்க, என்ன அது ரெண்டுக்கு சம்மந்தமே இல்லையே அந்த மாதிரி. ஸோ இட் கேன் do a lot of unusual things. That is unsupervised. Supervised is where somebody is validating, somebody is sitting and saying, okay, this is this, this is this, this is this, and training. Now then it gets more and more predictable and more also which is reliable. So what is the role of AI? If you see, it is going to be a big part in medical diagnostics. Definitely it's got a role in drug discovery, which people are already working on. There's a personalized treatment with artificial intelligence, and then definitely it's going to improve the patient outcomes and also patient related things. Now it may be related to travel, it may be related to reducing the footprint and things like that, but these are all some of the major areas where AI is playing a role. If you take diagnosis, we all know, no? When we have a problem, it's kind of time consuming process. No? You have to do a lot of investigations and do a lot of tests, and then we may have to come up with certain diagnosis. And also there is a demand. We know the number of doctors, 1 in 100,000 in a country like India. It's still very less. In US it's 1 in 10,000. Even then they find it difficult to manage people. When you talk about ophthalmologists, it's still the numbers are huge. So there is a lot of need for medical professionals. And also it's stressful for existing doctors because of the delay in diagnosis. So how machine learn to diagnose? So there are a lot of concrete examples and they are all very neatly digitalized. And then you have these engineers sitting and then training the machine, the neural network. Because I had an opportunity to visit the Google AI center in Los Altos in California. And they said we have shifted the campus from the main Google campus to a different building. So they showed me the main building. There were like different blocks we were going around, and then they said we have shifted our AI to a different place. I said why? Because we can't accommodate. I thought, what is this, 10-20 people? There are so many offices here, why can't you accommodate? Then they took me to that new building in their driverless car, Waymo. It's called Waymo. You sit like your Tesla. Google is developing a driverless car. So they made me sit in that car and they said, Google, go to AI office. It's going on its own. It's going into the highway, it's going up, down, and then it went to another building. This was a huge facility. It was a 12-acre campus with, I don't know, maybe 100,000 or 200,000 square feet like this building. Like, a lot of people get surprised when they see Eye Hospital so big. No, I was surprised. What is happening? And they said there are 600 engineers working. Oh my God. 40% from T Nagar. So then I understood. Now there are 40% Indians there. Okay. There are all kind of working on 4 areas: ophthalmology, dermatology, radiology, and also in another field. So there are 4 areas where they are intensively working, and they develop a lot of algorithms which can identify the patterns and the small deviations or the variations which can help us to diagnose the disease. So some of the, I'm not going to in detail, because this is not a very easy topic, but there are a lot of things which are already validated and very good evidence. I'm just going to touch upon some of them. So this is one thing, where there is end-to-end lung cancer screening with 3-dimensional deep learning on low-dose chest computed tomography. And they say that AI can beat a radiologist in detecting lung cancer. Even the smallest finding or the smallest change, it can pick up. Same way, the congestive heart failure. They say AI neural network detects heart failure from a single heartbeat. It can detect. So that is going to be the future. Like we talk about some of the very senior physicians, they say, our stetta vachone and the murmur vachi solliruvaru sir. And the mari, from a single heartbeat, your AI is going to make what I said to begin with. Some of the sitting idiots outside, it's going to transform. So in dermatology, it's coming in a big way. I'm sure dermatologists will have more work. They may think that their work may reduce, but they'll have more work. More people will diagnose what their condition is, and they may come early to you also. So once you take an image and then you put an app into it, and then it will say exactly what skin disease. It will compare with millions of images, and then it will come up with a diagnosis for you. So Google says that its AI can detect 26 conditions as accurately as the best dermatologist. So now they are working on several other conditions like that. So this is one way we were doing diabetic retinopathy screening. This is in Madurai, where they used to have 14 MV diabetic clinics. All the 14 clinics were connected to Madurai Aravind through a telemedicine network. So because they didn't have an ophthalmologist in all the centers, so we put technicians, and they used to take fundus images, and then the fundus images were sent to the base hospital in Madurai, where we had a reading center. The ophthalmologist will see, grade the retinopathy, and give the report back to the technician. And the technician will say, okay, so உங்களுக்கு சக்கர வியாதியால விழித்திரை பாதிப்பு இருக்கு, லேசர் பண்ணணும், so you should go to the nearest eye hospital or to Aravind, wherever you are convenient. And this process, now it used to happen like this. It used to take an hour now, 1 hour. When I talk to machine learning experts, ஒரு மணி நேரம் என்ன பண்றீங்க? So they say, what are you doing for 1 hour? And then they started working on this. So that is how we started working with the Google team in artificial intelligence way back in 2013. So to apply these concepts in diabetic retinopathy, because we already had terrific data. So much of telemedicine activity happening. So we had so much of information, and the best part was all these data were de-identified, without the patient identification. So that is very important. So all these were available, and we already had a platform of finding out hemorrhages and exudates with our own software called Address. And that's how this started working. And now this algorithm which the team has created, the Google team, has got a very high sensitivity, almost like 97.5%. That kind of an accuracy. It's almost there. So it can be much, much better than some of the ophthalmologists. So what you basically do is you drag the image, You put it into that software program, and within a few seconds, it will give a report. Now it will say probably it's a mild to moderate. There is no diabetic macular edema. So the grading is moderate to severe. So it needs a referral. Or it will say no refer. Now it will say either you don't need to refer or it refer at this point of time. And it can classify the retinopathy like this. So in this condition, it's severe proliferative. Now there are a lot of new vessels and things like that. So it says it's proliferative. You have to immediately refer this patient. So this particular study was a landmark study which was published a couple of years back, and some of you would have seen this video.
Healthcare is one of the most important fields AI is going to transform. Last year, we announced our work on diabetic retinopathy. It's a leading cause of blindness, and we use deep learning to help doctors diagnose it earlier. And we've been running field trials since then at Aravind and Eye Hospitals in India, and the field trials are going really well. We are bringing expert diagnosis to places where trained doctors are scarce. It turned out, using the same retinal scans, there were things which humans quite didn't know to look for, but our AI systems offered more insights. Your same eye scan turns out holds information with which we can predict the 5-year risk of you having an adverse cardiovascular event, heart attack or strokes. So to me, the interesting thing is that, more than what doctors could find in these eye scans, the machine learning systems offer newer insights. This could be the basis for a new non-invasive way to detect cardiovascular risk. And we just published the research, and we are going to be working to bring this to field trials with our partners. Another area where AI can help is to actually help doctors predict medical events. Turns out doctors have a lot of difficult decisions to make, and for them, getting advance notice, say 24 to 48 hours before a patient is likely to get very sick, has a tremendous difference in the outcome. And so we put our machine learning systems to work. We've been working with our partners using de-identified medical records. And it turns out if you go and analyze over 100,000 data points per patient, more than any single doctor could analyze, we can actually quantitatively predict the chance of readmission 24 to 48 hours earlier than traditional methods. It gives doctors more time to act. We are publishing our paper on this later today, and we are looking forward to partnering with hospitals and medical institutions.
So that's how it's going. Now all these IT companies from Uber to Ola to Airbnb, they are coming into health. Whether we want or not, they are there. They can predict so many things. So this particular AI work in DR was so interesting because beyond just diagnosing severe diabetic retinopathy, the images started saying, what is the age of the patient? The predictability was almost 95%. What is the sex of the patient? What is his HbA1c? What is the systolic and diastolic blood pressure? What is the stroke or cardiovascular event in the next 5 years for this patient? So it started learning how the vessels are. It started learning how the changes in the retina, and it is able to predict so many things. So even that, they say, I met one of Sundar Pichai's colleague. He was saying, if you give me an image, I can tell how many years he was smoking now. So it's like that. So everything maybe there. They said, I was very curious. Now I've been asking this question to whom I meet. What is the plan now? What are you going to do with this? He says maybe in the future, it will be like a weighing machine in all the mall, where people will take their own retinal image and they'll get a summary. So he says your doctors are going to be more busier. Don't think that we are going to take your job. You are going to become more busier. People who are not aware of this will be aware now. When you say that your 5-year stroke to happen, you have 40% risk. Definitely, I think then he'll come, right? At least then he'll come saying that my blood pressure is high or my HbA1c is high from his retinal image. So that is how it's going to go. The other important area is drug discovery, because drug discovery takes years to gather. Some of the drugs took several years to develop, and there are millions of investment. So now they are working on a lot of this data, like what Sundar Pichai was saying, so that it can identify the target molecules quickly, and also it can speed up the clinical trials, and it can also find biomarkers for diagnostics. So this is a very busy slide, but there are so many companies. If you see, you can identify many of them: Allergan, Santen, all these Sanofi multinational companies. They are extensively working on artificial intelligence in their R&D to develop a lot of new drugs. And when we talk about personalized treatment, like what Sundar Pichai was saying, we can predict the readmission rate even before he goes to home. Discharge la panna mudiyadha vairu. AI solludu 76% நீ திரும்பி admission. No, be here. So like that, it can personalize a lot of things. So different patient response, the way they respond to drugs are different. Somebody in ashram was saying, sir, 17 வருஷத்துக்கு முன்னாடி நீங்க கேட்ராக்ட் பண்ண மாட்டேன்னு சொன்னீங்க, பிபி அதிகமா இருக்கு, 180 120 கண்ட்ரோல் பண்ண சொல்லி. அவர் வந்து கரெக்டா கேட்ராக்டுக்கு கண்ட்ரோல் பண்ணாரு. அடுத்த 17 வருஷம் அவர் இன்னும் மாத்திரையே சாப்பிடல, சேம் 180 120 நல்லா இருக்காரு. ஸோ நீங்க எதுக்கு கேட்ராக்டுக்கு கம்மி பண்ண சொன்னீங்க அப்படின்னு there was a question. So now each individual is different. Each individual, the way the drug, the treatment, everything works is different. So AI can predict a lot of things in the future, and it can identify which factor affects the treatment choice and the challenges behind it. And also it can automate this complicated statistical works and make it simple for us. And it can predict a patient's probable response also to a particular treatment. So we all know how it is coming up. All your smart watches, now they are worried whether these smart watches are also connected to somebody. Like your Facebook, we don't know whether these are also connected. You are wearing here, it takes all the information from your phone to somewhere, because it's connected to your phone again. Everything is connected through your mobile number or your account, Google account or your. So that's why they very easily they ask whether you want to become you want to log in through your Google or Facebook. It becomes easy for you. You do that, everything is connected now. So all your information can be taken for a lot of data and research. So we know how it has revolutionized these smartphone phones. And AI, it can predict coronary artery disease. AI can predict breast cancer 5 years ahead. These are all very recent publications which came up in the last 2-3 years. And also it's used in a lot of training also, like neurosurgeons train on AI-based virtual reality. We are also working on something similar to this to make sure how we can use some of this for training also. So these are the limitations. At this point of time, there is a danger of de-skilling the physicians. You can't say that it's an holistic approach. It's also limited by the quality of data, because some of the data which we shared was our retrospective, old data where we don't know exactly whether that was the blood pressure or the blood sugar status of the patient. Now we are going to do a prospective work with Google to also see whether all these variables are correlating. And data also we need from wide range, across the world we need. We can't just say Indian data, Singapore data would work globally. And some programs cannot hold good for different types of make and model of machines what we use. So we need to standardize a lot of things at this point of time when we are working on AI. So the future is between these two. We are in the crossroads, whether it's going to de-skill the physician and replace, or it's going to make our job, and enhance the physicians and provide better care for our patients. So I think I am very optimistic on the green side. I am sure some of you will be on the blue side, but the future is there for AI. Thank you.